Does curcumin work for migraines? Migraine is a prevailing health state linked with considerable pain and discomfort in the head. Movement, light, noise, and other spurs may induce symptoms like tiredness, nausea, visual disturbances, numbness and tingling, irritability, difficulty speaking, temporary loss of vision, and many more. This neurological condition can leave you in bed for days. Researchers have discovered that curcumin for migraines is an alternative natural remedy that instantly reduces inflammation in the brain by protecting cells from free radical damage. Neurogenic inflammation has a crucial role in migraine, and curcumin is a renowned herbal compound that has anti-inflammatory effects against suppressing this neuroinflammation. Curcumin in turmeric gives curry its yellow color, but it's also being studied as a treatment for many diseases, including cancer and arthritis. More than 200 million people worldwide are living with migraine disorders. Several medications can help relieve migraines, including aspirin and ibuprofen. They don't work for everyone. An alternative and natural treatment is curcumin, which is found in the spice turmeric. Many people take curcumin supplements to help ease joint pain or boost their immune system after an illness. But recent studies have also shown that taking curcumin might reduce migraine symptoms in some people who suffer from this condition regularly. But how does curcumin work for migraines? Turmeric is a leading herb that has been used for thousands of years. It's most commonly used in cooking and is now available as a dietary supplement. In addition to curry and kitchen staples, turmeric fixed many ailments in the past and present, such as headaches and digestive problems. The main active ingredient in turmeric is the compound curcumin. Curcumin is helpful for a variety of things, including reducing inflammation and pain. To ensure curcumin absorption, consume it with fatty foods and take prescribed amounts to see any effect. Luckily, another ingredient called piperine, black pepper extract, helps increase your body's absorption of curcumin. Still, it is present in many dietary supplements designed specifically to take advantage of this bioavailability, absorption, that helps curcumin to boost and increase its effects in your bloodstream. Still not convinced? Let's ponder studies and research. Method: double-blind study. Double-blinded study design prevents bias from creeping into the results. In a double-blinded study design, neither party knows what they're getting until after they've received their respective treatments and completed their follow-up interviews. These interviews provide information about whether each participant thought they had been supplemented with curcumin or the placebo, and if so, how much relief they experienced from taking one over the other. What happened in the double-blind study? According to the National Library of Medicine, the study sought to calculate the effects of curcumin supplements on clinical as well as serum levels. 44 women with migraine received 500 milligrams of curcumin twice daily or placebo supplements for 8 weeks. It also calculated clinical symptoms like headache severity, duration, and frequency at the baseline and end of the study. Results of double-blind study. Compared with a placebo, curcumin supplementation led to a significant reduction of migraine after 8 weeks. Headache frequency showed marginal improvement in the curcumin group compared to controls. Clinical trials pertaining to curcumin's ability to reduce the frequency of migraines. In a clinical trial, the patients who took 600 milligrams of curcumin per day for 3 months experienced fewer impressions of migraines than those taking a placebo, and this was true even though both groups had similar reductions in other migraine risk factors, stress levels and physical activity. Hence, people who took curcumin had fewer migraines over the 3 months of the study than those who took a placebo pill. How to take curcumin for migraine headaches. Curcumin supplementation is regarded as safe, and no harmful effects have been briefed at lower doses. One older study on 10 adults showed that taking 250 to 490 milligrams of curcumin daily for a week provoked no side effects. Above 1,000 milligrams yields digestive issues. 450 milligrams or higher may cause headaches and nausea. 8,000 milligrams or higher dose causes a skin rash. Extremely high doses of 1,170 milligrams per pound, 2,600 milligrams per kilogram of body weight daily for 3 months or up to 2 years may cause severe side effects in rats. These include increased liver size, stained fur, stomach ulcers, inflammation, and increased intestinal or liver cancer risk. However, the quantity produces the poison. No evidence exists that lower amounts of curcumin cause severe side effects in humans when consumed over short periods. Yet, human studies on the long-term impacts still need to be included. Based on current research, clinical trials, and studies, curcumin is a safe and effective treatment for migraines. Curcumin has shown commitment to preventing migraines. We hope you continue exploring and experimenting with curcumin for your migraines. It's important to remember that this is just one study. There are many other things we still need to learn about the effects of turmeric supplements. So we encourage everyone to consider taking them to do their research before starting any new treatments. However, one thing is for sure: curcumin's antioxidant capacity helps prevent migraines by protecting your brain from free radical damage. In addition to curcumin, turmeric contains other compounds that can be helpful for migraine sufferers. Piperine, black pepper extract, fosters the absorption of curcumin by up to 2,000%. Gingerol has anti-inflammatory effects and may help reduce blood flow during a migraine attack. Thank you for viewing this video. If you like it, please give it a thumbs up and subscribe to our channel.